Want to go back to Dr. Kaz Nakagawa, a neurologist from the Queens Medical Center, with certain things a woman can eat when she's pregnant that'll be beneficial to the baby. Let's send it over to Marissa.
Thank you, Bridget, and thank you again for being with us, Dr. Nakagawa. Now, all parents want a baby that's going to be healthy, and you being a neurologist, what foods can a mother eat while she's pregnant to help with the baby's brain development?
Sure. So the brain itself is almost made up of fat. Okay. So the building block for the brain is omega-3 fatty acid, which is a very healthy fat that you can get from fish. You can't really get it from red meat or chicken or any other form of food. And without the omega-3, you're just not giving enough building block for the developing brain. So that's the most important nutritional component if you're thinking about brain development.
And what kind of fish? Salmon, tuna, anything else?
So small fish has much lower level of mercury. So salmon, mahi-mahi, butterfish, canned tuna is actually okay. But the bigger fish, such as the big ahi or marlin or swordfish, they tend to have a higher level of mercury, so I would avoid that.
Okay, so what about some women who don't like to eat fish? Are the pills good enough, the omega-3 pills?
So it's debatable, but I think omega-3 is very important. So for people who don't eat fish, I think taking supplements of omega-3 is a good idea. And I think there have been some studies that have shown that people who don't take enough omega-3 or fish have had a higher risk of the baby developing dyslexia, attention deficit disorder, depression, bipolar, and even schizophrenia. And there's one large study that was published in Lancet, which is like a very famous big journal that looked at thousands of people and then grouped into pregnant women who ate a lot of fish and people who had no fish. And turns out that the baby, after 8 years, the babies where the mom didn't eat any fish had suboptimal verbal IQ, lower socialization and communication scores, and also fine motor movement scores. So that really highlights that eating fish during pregnancy may be beneficial for the developing brain.
And you speak from experience. You have 2 little kids, and your wife, Kristen.
I made sure she took omega-3 supplements and ate salmon frequently.
And they're brilliant, cute and brilliant.
Thanks, Marissa.
So it ensures a healthy brain and also ensures that you won't develop certain things like dyslexia. Does it ensure that the kid's going to be smart?
Well, I wish it was like that. I wish we can just keep giving omega-3 and make them like a genius, but it just doesn't work that way. But it's going to give the highest potential, maximum building blocks for the developing brain. So, a lot of the intelligence is determined by the gene and upbringing and education, but at least we're going to give the brain the best chance possible.
And one more question. You touched upon it earlier about mercury. I know in the past, parents have said, oh, don't eat mercury, don't eat fish because of mercury concerns. So what are your thoughts on that?
Yeah, so the medical community really feels that the benefit is the risk of mercury. And that scare of mercury really came from actually this incident in Japan back in 1950s and 60s in a place called Minamata, where there was an outbreak of fetal deformity from a high level of mercury. And that was because the chemical factory was actually dumping high level of mercury into the stream and river. And so there was an outbreak, and that was highlighted internationally, and that really got everyone scared. And the truth is, all the fish that we eat normally only have very trace amount of mercury in it. And if you really select the fish appropriately, like salmon, the smaller fish that I talked about, I think the risk is very minimal. And I think the benefit is far, far greater than the potential risk.
Great information. Thank you.